Hello, my name is Luca Busetto. I am full professor of nutrition at the Department of Medicine of the University of Padova in Italy. SURMOUNT-1 study was one of the studies in the phase 3 of development of tirzepatide, a GLP-1 GIP agonist for the management of obesity. In the SURMOUNT-1, uh, more than 2,500 patients, adult patients with obesity or complicated overweight, were enrolled for a 1 year study in order to demonstrate the efficacy of the drug on body weight in particular. In the SELECT trial, the participants were not affected by diabetes, but almost 40% of the participants, they had pre-diabetes. And for patients with pre-diabetes, there was a extension of the trial with a total duration of 3 years. And we work on this data for this particular study. The study design was a randomized controlled trial comparing three different dosages of tirzepatide, 5, 10, and 15 milligram against placebo. Of course, all the patients receive a low-calorie diet and instruction about physical activity, and the randomization was continued in patients with prediabetes for all the duration of the trial 3 years again. In our study, we observed a very good weight loss, as previously demonstrated in the original paper, and the loss was very stable for the 3 years. But of course, there was some variability in weight loss, and we try to identify pattern of weight loss, and we use a sophisticated data analysis. And for the analysis of the speed of weight loss and the time of weight plateau, we identified three different groups of patients. And the important things is that these three different groups start to differentiate at the very beginning, demonstrating different rate and speed of weight loss. This could be really important because we can, in this way, identify different responses. So we can better identify the patients that can respond better to the therapy. In practice, the key message is that you can start using the drug in patients with indication, and to observe the weight loss in the first months of treatment. And on the basis of the weight loss in the first months of treatment, we can in some way to predict the total weight loss that you may obtain. This could be helpful because this you can identify earlier patients with the better responses, and also, of course, the fraction of patients with not so good responses. And in those patients, maybe there is an indication to intensify the treatment earlier in order to obtain the weight loss that you want to obtain. I think that our aim is to personalize as much as possible the therapeutic intervention in obesity management, and I think that this kind of analysis could phenotype better the patients, and could identify the patients that would respond most to the several treatment that we have now and we will have in the future. For instance, in our study, the patients having the better weight loss was mostly represented by female patients and patients without complication. This is a very initial information, and I hope that other analysis in other randomized controlled trials could help to better characterize the patients with the best responses.